Hi everyone, Nurse Yalda. Let's take a look at my 52-year-old patient. For this lovely patient, I'm just identifying some of the negative aging signs that we can correct. I'm going to identify now the points which we need to inject. Tiredness around the eye needs to be fixed. This is why we're doing filler for temple, cheekbone, and lateral cheek junction to provide structural support. So first, I'm going to numb the patient with 2% lidocaine. Temple correction can be done either using Restylane Lift or Juvederm Voluma. The temple hollowing is a common problem in the aging face. Volume loss with aging in the temple may be the result of atrophy of 1. The temple fat pad, 2. Superficial lateral orbital fat, or 3. Lateral temple cheek fat. For this lovely patient, I'm using Juvederm Voluma just in the superior medial quadrant of the temple fossa. While injecting the temple, I'm doing the 1 up and 1 over, which is Dr. Arthur Swift technique for the anterior deep temporal volumization. We palpate the topography of the temple fusion line along with the sigmoid temple fossa. I always ask the patient to open their mouth slightly. This way, it will help to relax the temporal muscle. Voluma or Restylane Lift, which are the hyaluronic acid filler with the highest G prime. Before injecting, we do want to feel for a pulse to make sure there's not vessel traveling across the injection zone. I'm placing the needle deep on the bone. We want to make sure our hand is steady. Also for safety purpose, it's so important to aspirate for 5 or 6 seconds. Next, I'm going to use our 25 gauge cannula. For the cannula, I always have numb the patient before inserting the cannula. The insertion site for the cannula is located along the anterior border of the sideburn. The cannula remains in the superficial fat and is advanced immediately. It is typical to feel some resistance as we're moving to cannula through the fat compartment. Cannula deposition can be performed in a retrograde fanning fashion until we have achieved our desired outcome. I do usually use 0.5 cc of G prime, high G prime like Lift or Voluma, and it really depends on your patient whether it's male or female patient. After my injection, I do mold the filler gently just to make sure the filler has been placed evenly. Right after the injection, you will see a beautiful lifting of the eyebrow. It is obvious to see the upper eyelids start to become more open. In addition, the lateral canthus starts to shifting upward slightly. Right after the injection, we do take picture with our 3D camera, and right away we do see a huge improvement when it comes to upper face of the patient's face. Aftercares are super important. You do want to educate your patient to avoid using alcohol, no makeup, and no exercising for the next 24 to 48 hours. Providing the post-op care is very important. We always let the patient know to ice for the first 24 hours, and after the first 24 hours, we do want to advise the patient to use hot compress to help with decreasing the inflammation. I do usually recommend arnica, which it can be provided over the counter. Whether it's a topical arnica or the tablet, either or is recommended. Please keep in mind patient will see the result, and after 2 or 3 weeks, follow-up appointments are important. Thank you for watching this video. Please stay tuned.